Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. Today, we'll be reviewing infection prevention and control resources available from CDC's Project Firstline and Pennsylvania Project Firstline. Everyone who has entered the meeting has been entered on mute, but we will have a discussion at the end of this webinar. So if you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. And you can also raise your hand to request to be unmuted and ask your question out loud. We invite you to join us every Wednesday at 2 p.m. for more of our weekly webinars. Next week, we'll be discussing colonized versus active MDROs, or multi-drug resistant organisms. And that webinar will be the same time and place next Wednesday at 2 p.m. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest today, Jenny Bender. Jenny is currently an infection preventionist with the Bureau of Epidemiology at the Pennsylvania Department of Health, where she is supervisor for Pennsylvania Project Firstline. Jenny, thank you for joining us today.
Hi, thanks for having me. Can you hear me all right?
Yes, we can. Thank you.
Okay, perfect. I'm going to go ahead and stop my video. I just wanted to pop on and say hello. I find it distracting to everybody, really, to have your camera on while you go over slides, and also we're potty training twin 2-year-olds in my house, so this eliminates the chance of you seeing something you don't want to see. I'm here today to talk to you about Pennsylvania Project Firstline and give you an overview of the resources that we have. We are also going to walk through one of the trainings that I really enjoy from the CDC, just to give you an idea of what a Project Firstline training will look like in your facility. So Pennsylvania Project Firstline is an innovative project. Our goal is to promote foundational knowledge on infection prevention and control for all types of frontline healthcare workers. So this does not mean just clinical workers. We really love to instruct EVS departments, dietary, activities, really anybody in your facility that comes face-to-face with a resident. This program was developed in partnership with the CDC, and our goal really is to build up Pennsylvania's healthcare workforce so that they're confident in their infection prevention expertise, and therefore keep the healthcare community and really the community at large safe from infectious disease threats. So we reach healthcare workers in all healthcare settings. Nursing homes and personal care homes are a big part of what we do, but we also will occasionally go into hospitals, different types of outpatient clinics and dialysis centers. We teach all types of healthcare workers, like I said, and we strongly believe that infection control works, that it's a team effort, and that it matters. A lot of the times these behavior changes seem inconsequential, but they really do add up and prevent infections in the people that we care for. All Project Firstline trainings are accessible, so no matter what your previous training or educational background, you really should be able to understand each training or video. And they're really concise, which is my favorite part about them. Healthcare workers are busy, they're burnt out. Any video that Project Firstline puts out will be a maximum length of 10 minutes long. In fact, the one I'm going to show you today, hopefully, if it works, is less than 2 minutes long. And a lot of this stuff is interactive to keep people engaged. There are built-in knowledge checks. There are different little games that you can play that are kind of choose your own adventure. So it's not just somebody talking at you all the time. So in Pennsylvania, we have our own Project Firstline website, and the link is here in the slides, which I do believe will be shared with you after the presentation. You can see right at the top is a training request form, which we're going to go over in a little bit. There's also an ad here for our text message program, which is one of my favorite things that we do. So if you text the word join to IPC4U, and so it's not actually going to be the letters, it's going to be the numbers that correlate to those letters. I forget what it is off the top of my head, but I can throw it in the chat later once I figure it out. Every Friday at noon, we send a different text. Sometimes they're fun facts. We try to throw emojis in there. Sometimes they're links to the short videos. Sometimes we feature partner activities, so what different states are doing, and some of the other Project Firstline partners like the AHA, the American Hospital Association. There's also the Association for Healthcare Environment that they do a lot with like different pathogen matchup games and stuff. So we try to keep the resources fresh in the text messaging program. We also have all of our like self-developed content on our webpage. So we try to, I mean, you do what you can do, but we try to organize it so it's easy to pull down. If you're not subscribed to the newsletters, you can pull down all of the old issues from our webpage. We have posters that you can either order, we'll mail them to you, or you can print them yourself if you have that capability. And then there are all the different links to the CDC resources as well. Our newsletters, we try to keep really simple, 2 to 3 pages. We try to tackle kind of hot topics. So this one you could see was our winter newsletter. We went into respiratory viruses and how to tell the difference between them. We put one of these out quarterly and we send it out via text. We have our state social media person put it on our Facebook and Twitter, and then we also email it. You can request to be on the email list on our webpage, or I also have our resource account information for you in the slides. We've done a series of posters that you may have seen at your facilities. Most of them were about COVID-19. Some of them, the dinosaur is my very, very favorite. That one, if you remember Dana, she made. I love the corgi too on masking. But some of them are just vaccines. We have a second series of posters coming out this year, so look for more of these. We also offer continuing education credits. So the CDC content actually is grouped into 7 groups. And this is a major part of the resources that are going to be coming out through Quality Insights. You can actually get CEs for doing them. It takes a bunch because they're short. They're about 10 minutes long. So you have to do a good group of them to get a CE, but those are available. And then if you go out to PA train, some of our longer Project Firstline presentations are available for 1 CEU as well. There is a link on our website at the very, very top. If you're interested in requesting a training from Project Firstline, we're happy to do in-person or virtual training for healthcare facilities in Pennsylvania. And so you can just complete the web form. It kind of lets us know your preferences on topics and times and what your target staff is. We try to keep it simple. Once you fill out this form, it will go right to our resource inbox. So it's just like a little bit easier than writing us the email to ask. And then we'll get back to you and schedule a meeting to talk about, your preferred dates and getting all the logistics ironed out to come and see you. So if you go to the CDC Project Firstline webpage, they have a lot of content out there. They usually have their featured stuff at the top. They have recently translated almost everything into Spanish, which is really great. I certainly couldn't do that myself, so I'm very grateful that they did it. And then there is infection control materials that are divided up into categories. The one that's infection control is really more general, but then they also have a lot of COVID-19 specific topics that are still up. There are a lot of different frequently asked questions and accomplishments pages. So if anybody asks you what Project Firstline is or why you should care from your leadership, these are all good references to use. And then my favorite series is the Recognize Infection Risks in Healthcare, because at the end of the day, this is really what it's all about, is learning how to recognize the risks in your environment and then potential steps that you could take to stop it from spreading. Infection control in healthcare is really more than just policies and procedures. It's an essential part of caring for and protecting patients and residents. So when you can understand and apply infection control actions consistently and confidently, every person, every action, every day, you can save lives. Infection control education for healthcare workers should be accessible and easy to understand. Project Firstline offers educational materials and resources that provide CDC infection control training for all frontline healthcare workers. So these can help you build your knowledge and keep you updated on the latest infection control practices for healthcare settings. And the products really range from like little bite-sized social media assets. So it might just be literally like an animated picture or a Facebook post that they've created for you, to complete interactive scenarios on how to identify infection risks, to toolkits and job aids. So if you're interested in hosting your own infection control trainings, there's even toolkits that teach you how to do that. All of these resources were developed with healthcare workers in focus groups, and they really try to make them not only easy for other healthcare workers to understand, but also to be trainings that they requested. And that's something that we at Pennsylvania, hold to heart too. Project Firstline is committed to creating resources that help frontline healthcare workers understand and confidently apply the infection control principles and protocols necessary to protect themselves, their families, and their community. So you can just see here, there's more promotional materials. There's a link to the page of all the materials in Spanish, and then there's a link to anything you can earn CE credits for if that's something that's important to your staff. There are videos, social media graphics, print materials, and then there are a lot of promotional events. I think there's one coming up, I want to say it's with the AMA, and the CDC will advertise these on Facebook. You can register and then you can go. This one's with Dr. Abigail Carlson from the CDC. I want to say it's like April 16th. I can get back depending on the exact date, but those are also really good to go to because those are kind of the forums Project Firstline holds to survey healthcare workers about what their training needs are. And I did say that there are some Spanish language materials that are now available. And there's a video where actually, let's see, gonna try and play for you here. Hopefully.
Now, Jenny, your screen share went away.
Yeah, and I don't know if you can share your screen for the video.
I'll put the video up on my screen and we'll share that.
Rather than try to sync the audio.
Yeah, that might be better. Let me get my volume turned up and hit play and let me know if you can't hear it.
You see a possible problem that could hurt a patient and you take action. You can use this same process of recognizing risk when it comes to infection control in healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and take action.
Looks like we've got some buffering happening.
Step in and take action.
Nope, that didn't help it. We'll give this another moment.
That's okay. It's only a minute long. I'll just bring the slides back.
Let me refresh one more time. We'll give this one more shot. My internet should be pretty good. I'm plugged straight in.
So why are we and take action to stop the spread of germs? So why are we so focused on germs in healthcare? The risk for germs to spread is different than it is at home and in the community. There's a higher chance for germs to spread in healthcare settings than, for example, a grocery store, because it's where patients who are sick come for care, and patients who are already weak or ill are likely to be more vulnerable to infection. Healthcare is also unique because some of the things healthcare workers do as part of giving care can put patients at risk of infection, like starting an IV. Sometimes we are the opportunities for germs to spread. We interact with a lot of people throughout the day. We touch a lot of things and we use many different kinds of equipment. And these are all ways we can spread germs. All of this is why we have to think about infection control in healthcare differently than we think about infection control in the community.
Okay. Stop sharing my screen and then you can share yours again.
All right.
All right, that looks good. I can see your screen again.
Oh, okay, perfect. And you can hear me.
And I'm seeing the Project Firstline screen, not your presentation slides.
Okay, let's see. Is that it?
No, we're back to the
I think that's her sliding.
I think that's my slide. Yeah.
Oh, okay. I thought that was the video.
Yeah, that's just like the placeholder.
Got it.
And so as part of the CDC training, you would show the video in its entirety. And then there, for each training, this one is recognizing risks. Some examples of different risks that you see. So what risk do you see here? A person's on a ladder, they could fall. And what steps do you take to mitigate that risk? Well, you hold the ladder for them while they change the light bulb. So although this is more of an example from practical life, what we do at work is not that different. So at work in healthcare, we mitigate risk all the time by cleaning up spills, by checking medication dosages, or by stepping in to help to see if we could, help a patient who's unsteady on their feet and could fall, as we talked about, in the video. So the same idea applies to infection control, except that the actions you take maybe aren't as obvious. But when there's a risk for germs to spread, you do certain things like cleaning your hands before you give an injection, or putting on PPE before doing certain tasks, cleaning and disinfecting high-touch surfaces like door handles, light switches, bed rails, call lights. Thinking further about the idea of recognizing risk as opposed to just, kind of doing things that were written down on a list that we were supposed to do, helps you think of times at work when you have a risk and you recognized it, and you stop the germs from spreading. So I'm sure you can all think of something that you've done at work to stop germs from spreading before they cause any problems. Excuse me. So healthcare is different because there is a higher risk of germs in healthcare. So there's a higher chance that patients might have an infection. There's actually a lot of research that's getting a lot of attention right now that I think you guys are going to talk about next week when you talk about MDROs. Patients and residents are more likely to be vulnerable to infection. The things we do as part of care can directly put people at risk of infection, especially when you talk about things like medical devices. And then the work that we do presents many opportunities for germs to spread, especially when we as healthcare workers are going from patient to patient to patient to patient. And sometimes we're carrying those germs with us. So I think when you stop to think about what makes healthcare a unique setting with all of these challenges and risks for infection spread, it really helps you start to think about the actions you take as mitigating those risks and not just something, infection control told you to do. So where is the risk for germs to spread in healthcare? So we're going to look at some photos, identify the infection risk in the photos, and then share some ideas. And this works really well when you have a small group. So here's a person coughing in a waiting room. So this person looks like they're a patient coming for care, looks like they don't feel good. The risk my eye is immediately drawn to is that person is touching a pen and a clipboard that's probably going to be, shared with another patient, but it also looks like she has a gap in her mask. So that could be a risk. And even the chair she's sitting in, if it's not wiped out immediately, could be a risk as well. Oops, a little out of control here. So this one looks like the same waiting room, maybe a different waiting room, and there's somebody here with a big wound, sort of covered up, but you can still see that it's actively bleeding. The person next to them, same thing, has a pen and a clipboard. And so there's also that risk there of germ spreading, but it's different than the respiratory risk. This one's going to be more of a contact or a bloodborne pathogen risk. And then in this one, there's no patient, but there's definitely still an infection risk. So my eye is drawn to the sharps overflowing out of that sharps container. There's also an overflowing trash can. You don't really, see what the trash is, but if it's things like used tissues or, other clinical items, it could certainly be. There are also a bunch of supplies near the sink. And that's not something you might think of, but if you're thinking about a bug like Pseudomonas, it could definitely be an infection risk there too. Lots of waterborne germs as well. So I think these images are really helpful to show in a small group and have discussion with staff. Kind of to bring it together, what's one risk for germs to spread that you might recognize in your daily work? For me, it's on my hands. Like, even though I work at home, I'm back and forth between, my little kids and my desk and other things in my house. So even though I'm not in a clinical environment, I try to wash my hands all the time. And I'm already answering the second question, which is, when you recognize that risk, what's one thing you can do to help stop germs from spreading? And so this might look like source control. It might look like hand hygiene. It might look like surface disinfection between patients or residents. But I think that doing these, rather than just going over slides and telling people things, asking them questions about risks that they can see in the environment is really helpful. And so you'll always offer an opportunity for questions, and then conclude your training with some takeaways. Risk recognition is seeing the potential for a problem to happen. You can help control infections in healthcare by learning to recognize the risk for germs to spread and cause infection and not letting it happen. And then healthcare is the unique setting. So we consider germs differently in healthcare than we do in other places. And that's because we have people that are at risk for infection. We have people that are more likely to have and spread infection. And then we are back and forth between those people. So at every training, they also provide all the resources, which is really nice. So the Project Firstline CDC website and Facebook, also the Twitter page. They just started an Instagram page. There's all of the videos on a YouTube page. So they've really covered the social media bases. You can sign up for emails. In addition to all of the content, you'll get invitations to those town halls. And then they have a feedback form. And so I did not add my own links because I have my own links at the end. So if you want any of the PA specific content, or if you're interested in the CDC content, you can come out to our webpage as well. And if you have any questions or training requests, or you want to get our emails, you can feel free to contact the team at ra-ch-firstline@pa.gov. Looks like
I've dropped those links in the chat. So we have a couple more things that we wanted to talk about before we moved on to the Q&A. But if you want, Jenny, we could have a short Q&A right now for your presentation before we move on to the next part. So if anyone has a question, you can drop it into the chat, or using the Q&A box, or you can raise your hand if you have a question. But we will have maybe 10 more minutes of presentation. So if this is too soon, we'll have more time at the very end to answer your questions.
Yeah, while we're waiting, this is Penny. While we're waiting, if anybody has any questions or comments, I want to say that what I really like about Project Firstline, the education, it's simplistic, but it's so effective, it's easy, and it teaches in all different ways. You know, I'm a visual learner, but you talk through it, you have the reflective questions, ways that you can put things into action. I just think it's fantastic. I don't know how many people have used it, but I really like it a lot.
Thanks, Penny. And Penny Imes is the nursing home team lead for our project. And since there's no questions yet, I think we can move on to introducing Deborah to talk for just a moment here. Deborah Wright is Quality Improvement Specialist here for Quality Insights.
All right, thanks, Kathy, and thank you, Jenny. That was a very great overview. I remember when we were working with her and collaborating on this, when she was showing the website, I remember the one phrase she says, you open up the website and then you can go down so many different rabbit holes and maybe not find what you're looking for, or find what you're looking for and just keep going in all these different directions. So one thing that we did based on that information was we kind of created a Project Firstline flyer. So I don't know if Kathy, if you can pull that up as we're talking here. We created a Project Firstline flyer with some direct links. So you can certainly go to their main website. That link is also on the flyer. But we added some things that can take you right to some direct links that maybe you're looking for. And those educational resources that Jenny was talking about, if you click on this link button, it'll go right to those educational resources. All the videos that she was talking about, Kathy's actually going to demonstrate it for us. There we go. all those instructional videos that she was talking about. Again, there's a link to all of them. We have also taken the opportunity to view all of these videos. They are all still current and up to date with what you should be doing in the facilities. So I know we have been talking a lot about the QSEP trainings where they have the CMS's targeted training for frontline staff and management staff for COVID-19. We kind of took those modules and we said, okay, which videos does Project Firstline have that may align with some of those modules, so that if your facility is not able to have the staffing or the time to do those modules, which we all know take 3 to 4 hours, they're great trainings, but sometimes you just don't have that time. Where Project Firstline, as you can see, some of the videos are 2 minutes, 4 minutes, 6 minutes. They are those short snippets. But the other thing that you can do with these videos is maybe those videos are only watched by your staff development person or your infection control nurse, and then they use the information that's in those videos to create your own infection control program. So as you're doing that, you can watch these videos. The other thing that Project Firstline has is a facilitator toolkit. So if you click on that, and Kathy, since you were demonstrating, if you can click on that link, they have trainings. And if you go down, and Jenny, you can help me if I'm going in the wrong direction here, but see there, you can go down. So if you wanted to say, if you wanted to do a presentation on where do germs live, they have where you can do it in a 10-minute, a 20-minute, a 60-minute presentation. So you can review their session plans and their PowerPoints and come up with your own training to present that to your staff in the time that you have available for that topic. So we kind of in one spot tried to put everything there for you, that you can just click on those links. Yeah, there, where you going, Kathy? There we go. Where you can click on those links and go right to that spot on their website. And then at the bottom of the resource, it actually has Project Firstline's website, which will take you right to their landing page where Jenny was talking. So we have talked to you, we feel like a lot over the past year about the CMS's targeted COVID-19 training for frontline staff and management staff. And we have heard all of your barriers that you face with that. So we have reached out to CMS and we have gotten some alternatives that we can use in place of that QSEP training if that's what your facility chooses to do. At the end of the day, they still want to ensure that every facility is ensuring that you have your infection control training and your COVID-19 topics that would be presented in their CMS targeted training, but maybe you do it through another source. Maybe you do it using Relias. And these are paid services that the facilities have. Maybe you do Relias or Health Academy or HealthStream, and you have infection control and COVID-19, and that's great. We just need to get that information so that we can ensure that, lack of a better phrase, you get credit in CMS eyes for doing that as an alternative to doing those targeted COVID-19 trainings. The other option that we have worked with CMS is this Project Firstline. So Project Firstline, their resources are fantastic. They're up to date. They're short snippets. They're easy to follow. They're easy to understand whether you are the director of nursing or infection control nurse, or you're the maintenance or housekeeper. It's in language that is understood no matter what your educational level is. So that is one thing that we found very beneficial with that. So we have created a survey to see, what do you use? Do you use a paid service such as Relias or Health Academy? Or are you looking to accomplish your trainings through the QSEP and the targeted COVID-19 trainings? Or do you want to start utilizing Project Firstline, or do you already use Project Firstline as your resources? So we will be sending that out to the facilities in the near future. If you are a facility that wants to get a jump start on it, I do believe Kathy's going to put that in the chat that you can do that survey now. But we will be reaching out to all of you in the near future with a Survey Monkey to do that. As we talked about, this was Pennsylvania Project Firstline. West Virginia does have a Project Firstline as well. Christopher Henry is the Quality Improvement Specialist for West Virginia, and he's been working with West Virginia Project Firstline. So he's going to take a moment and introduce who that representative is. And in the near future, they will also be presenting and talking about their Project Firstline for West Virginia. So Christopher?
Thanks, Deb. Yeah, I just wanted to mention, and she is a guest on today's show, just not one of the panelists. Her name is Joni Price. She's with the West Virginia Project Firstline, and she'll be presenting in the next few weeks for us at another one of the DCO calls here that we have. And then also, if you can't make the DCO call, she'll also be presenting at the next West Virginia nursing home meeting that we're going to be having. And her contact information was put in the chat box at the beginning of the webinar. Oh, she
just holding off on putting it in until after we introduce Joni. So yes, I just included Joni's contact information.
All right. Thank you. Turn it back over to you, Deb.
All right. Well, I think we're actually ready for the Q&A portion of the webinar, unless Deb, you had anything else to say before we wrap up.
Nope, we can take any questions that they have. And if you'd like to answer the survey now, feel free to click on that Survey Monkey link that's in the chat. And we will do our best not to send it to facilities that have already answered the questions. Can't say that one won't get through there, but that is our goal, is to only ask you once.
Mm-hmm. All right, thanks, Deb. So in a moment, we can start the Q&A portion of this meeting. There's nothing in there yet, so I'm going to go over just some quick things about next week's webinar and some other events that we have coming up. And actually, I just lost my Zoom screen, so I need to pull that back up too. All right, here we go. Okay, so
I can take that question. So how do centers get credit if not done through Relias? So Relias is a paid service, so we don't expect any facility to utilize Relias unless that's what they're already using. So if you use Relias or any of the other paid services at your facility, such as Health Academy or Health Stream, you would either reach out to your quality improvement specialist, myself, Penny, Patty, Shirley, Christopher, and we will enter that into the system. If you do not have one of those paid services and you're using the free services, the two options are the CMS targeted COVID-19 training for frontline staff and management staff, which is in the QSEP portal, or by utilizing Project Firstline resources. And you would just tell us that which avenue you want to go. In the near future, once we have all of these responses back, those facilities that are not at least 75% completion for their Project Firstline or their QSEP training, we will be creating small work groups for each avenue. So if you want to do the QSEP route, that's what your facility has chosen, we'll have a work group and we can help you come up with ways to work through that. If you, as a facility, choose to use the Project Firstline resources and do that as your training, we'll have a work group and we will help you come up with ways to work through those options. So the free services, again, are Project Firstline, either Pennsylvania or West Virginia, but it's ultimately, I believe, in the CDC website, or CMS is targeted. I feel like this is such a long sentence. CMS targeted COVID-19 training for frontline staff and management staff. And that can be done through the QSEP portal, QSEP, and it stands for Quality Safety Education Portal. If you look at our weekly newsletters, there are flyers in there that explains all about QSEP and how to access it, how to change certifications from one facility to another facility. So if you have staff that say, well, I completed it at facility A, and now they work at your facility, you can transfer their certificate of completion to your CCN number, and that will give them credit. And if you are doing Project Firstline, there's really no certification. It's just that you're stating in your policies and your educational program that you are utilizing those resources, whether you are utilizing the resources as the infection control nurse, staff development as a resource to create your infection control programming, or you're actually requiring them to watch the videos. That is how you set that up at your facility. And you just tell us that that's what you're going to use.
All right, thanks, Deborah. If anyone else has a question, please submit them using either the chat or the Q&A, or you can raise your hand if you would like to be able to ask your question out loud. I'd like to take a moment to invite everyone again to next week's webinar, which will be colonized versus active MDROs, and that will be next Wednesday at 2 p.m. again. And I'd also like to invite you to bring your questions to our virtual live chats, which are each Tuesday and Thursday at noon. And Deborah Wright will be there to answer your questions on pretty much any topic. Some that come to mind are quality improvement initiatives, infection control, or MDS coding. And you can find the links to join those live chats or future webinars in either our last minute lowdown e-newsletter, which goes out on Fridays, or if you receive the email reminders that I send for today's webinar, I put the links in there too. And if you're not on our mailing list for either our newsletter or our webinar reminders, but you would like to get those emails, you can contact me at caudill@qualityinsights.org, and I will add you to the email list. And I'll drop my email in the chat shortly. I'd also like to say we'll be getting in touch. I'll be sending everyone here today an email later this week with the recording for today's webinar. And I believe Jenny said it was all right if we shared the slides too. So I'll be sending that too.
Absolutely.
Oh, we got a cat on the call.
Yeah, we got a cat. We got all kinds of stuff around here.
That's great. Okay, so let's see. Unless you guys, Deb, if you're seeing any questions, I don't think I see
No,
any.
Jenny or
Joni.
not Joni. Yes, Joni. Joni and Jenny.
Joni today.
Joni is looking forward to presenting West Virginia Project Firstline. We're looking forward to having her and what services they have. And Jenny, I want to thank you for all your collaboration with us and presenting today and showing the nursing homes all the different resources that you have available.
Absolutely. Thanks for having me. We really strongly believe that education does not have to take a long time to be effective. So we're happy to be a part of it.
Thank you.
All right, thank you. So yeah, it looks like that's it for questions. So I think I'll go ahead and sign us off here unless anyone has any last moment things to say. And it doesn't look like it. So Jenny, thank you so much for joining us today and for this great presentation. And I'd like to thank everyone here for joining us today and hope you can rejoin us next week.
Thank you.
Thanks. Bye, everyone.
Bye.
Thank you.